we are live. I'm really excited to bring this topic today to our community with you, Dr. Danielle Barber. And my quick introduction about Dr. Barber is that she serves on our medical advisory board and has for several years now. You joined our board of directors last year. You are based out of the Children's Hospital of Philadelphia in Pennsylvania, or CHOP for many that know the acronym. You are, and you can get into the nitty gritty of this, but you're a pediatric neurologist. You are also a basic scientist, and we'll get into what that means a little bit because I don't think that's a term that a lot of people are familiar with. But you are studying HIE in the HIE mouse model, the Vannucci model, and in sex differences. And you also are an HIE parent, which is also why I call you the triple word score, because you have so many wonderful perspectives to bring to this. And you have been just instrumental in so many things since you've joined the board to elevate our organization, elevate the HIE community. This week, we're really focusing on advocacy in our messaging too. And I think this is such a great way of sharing about different ways that advocacy is defined as well. And so we're going to kick it off there. So if you want to give a little bit more in depth of who you are and your history and interest in getting involved in neurology.
Yeah, sure. So thanks, Betsy. And I'm happy to be here today and talk with the community about the importance of engaging in research, because it's so important and we really can't do it without the whole community. So how did I get on this journey? Everyone always asks kind of when I turned into the HIE lane. And I was always curious about how the body works and especially how the brain works. And so I always knew I was going to go to medical school. And when I was in college, I was a neuroscience major, and there was a requirement to engage in basic science research. So in my sophomore year, I joined a lab, Dick Wortman's lab, and had a fantastic exposure to research, really loved being in the lab and the thrill of discovery with doing experiments, and had wonderful science mentors. Decided to apply to MD PhD programs. Again, fantastic scientific mentors, Marina Picciotto and Bruce Hope, through my neuroscience PhD. And towards the end of my medical school training, I was already deciding to apply for residency training in child neurology. So I was kind of already a neuroscientist, already headed to becoming a child neurologist. And our oldest daughter was born, and she was a preemie and had HIE. And so that definitely was and has been a growing and learning experience, and has changed the focus of my career. So now my whole career focuses around HIE, really from the, as you mentioned, basic science through the clinical science. And from on the basic science side of things, work in the lab, study a mouse model for HIE. And you mentioned it briefly. There are several different models. This is kind of the one in which therapeutic hypothermia was based, and study specifically sex differences in the brain immune response to hypoxia ischemia. I think this kind of science is really important because that's where we're going to make the discoveries to find new potential therapies. But we also need to engage in other kinds of science, clinical research, in order to see of the therapies that are on the table that we can start to explore in humans, what is helpful and what is the natural history of HIE, what happens to people after HIE, that I think we're going to talk more about today.
Yes, absolutely. Thank you so much for sharing that. And just for clarification, because when I first heard the term basic science, the term basic really threw me off. So because I feel like what you do in the preclinical space of basic science is anything but basic. Like, it seems very complicated. So can you talk a little bit about that definition?
Oh, it's funny. And, basic means generally that it's the underlying fundamental aspects that are the principles of how the body responds, or the basic biology, basic physics, basic chemistry, right? The underlying fundamental principles. Some scientists who are truly basic scientists wouldn't consider what I do in a mouse model of a disease to be basic science. They would call that translational science. And so it's this funny definition. But usually some folks feel that translational science is heading towards humans, and this mouse model for a specific disease is on the edge between basic science and translational science.
Got it. That's very helpful. So that way we can, kind of get a good starting point when we talk about this.
Sure.
And something that I find kind of challenging as we've gotten so involved now in the research landscape as an organization, and as I've been serving in this role for a couple of years and having lots of meetings with researchers and different people that are reaching out about potential collaborations as they're looking at different aspects of research, is really just like translating this back to the community. So we're really excited about this event today because that's something that I'm really hoping will be helpful for everyone that's tuning in. Because as you know and have experienced, there's a lot of settling into this life and figuring out, like, I need stuff to be better for my child now. And what does this mean? And how do we move this forward as a community? So let's start kind of past, present, future, and start in the past of the evolution of research and data with HIE. And talk kind of a little bit more about the last decade, because that's where a lot of this acceleration is really taking place.
Yeah, so we do have one treatment for HIE at this point, which is therapeutic hypothermia or cooling. And that has moved from clinical trials to accepted standard of care for certain infants. We know that therapeutic hypothermia or cooling decreases mortality and disability in moderate and severe HIE as it's defined in the first 6 hours of birth. And it's used here in the US and in Canada and in Europe and in other places in the world. There's also over the last decade been a lot of work trying to understand how we can move beyond that narrow band of cooling to understand how can we improve on that. There were studies looking at whether cooling deeper to colder temperatures, cooling for longer, starting later could be beneficial, and those were not found to be helpful beyond the standard regimen. There was a trial, the famous Helix trial, that looked at therapeutic hypothermia cooling in low and middle income countries and found no benefit and actually increased mortality. And so it's clear that cooling or therapeutic hypothermia is a major step forward. It is a treatment. But it's not applicable to all kids with HIE, and it's not a cure. So even after cooling, many kids have various impairments or disabilities. So it's clear that it's a good step forward. It's a good step in the right direction. It's better than where we were a decade ago, but we need ongoing research into more treatments.
Absolutely. And so I think some of the interesting things that have come up in this past decade in particular, you mentioned a bunch of different studies, many of which our families have participated in. So, we now have a community of over 10,000 families connecting worldwide. And when we talk about, cooling and different resource settings and things like that, we have a lot of questions. There was just a family that joined us from India, and they're, devastated to hear that their child did not receive cooling, and then we were able to share a little bit about the Helix study, and that it, whether there's, opinions on jury's still out or confirmed, the study results showed that in settings like India, Sri Lanka, Bangladesh, there was no benefit in hypothermia, and actually there were more adverse events and higher mortality. So, it's cooling obviously is not the golden ticket we all thought and hoped it would be. But, there is, we're moving into this the now and the present and where things are moving forward to. So let's, and we can also talk about this past decade as well of having a study that many of our families participated in. We had almost half the cohort of the HEAL study, which was looking at cooling plus EPO. And I will not try to slaughter the actual medication name because I still struggle with it.
Erythropoietin.
Thank you. And the co-investigators on that were Dr. Sunny Jewell and Dr. Yvonne Wu, who came to us about the 24-month mark when they were looking at, families coming back for these 24-month appointments and, partnering with us to get the word out, to have people come in and try to get those follow-ups complete so they could get the data complete, right? And which is kind of the focus of what we're talking about today. And then when the trial concluded and it was announced, we talked with them as well about that, that announcement structure, because it was the New England Journal of Medicine who wanted to have, sometimes this is very common, they have an embargo of information because they want to be the first out with it. But we knew families were going to find out. And how could we help support families to find out that the study was what they consider a negative study? And when, the term negative, again, just like basic in this context, I think is really important to talk about. And so families, we knew we're going to have all sorts of feelings about putting in all this time and energy and hearing that there was no difference between, the babies that were cooled and the without EPO and with EPO. But talking about what is going on now with that study and with others and what we are learning.
Yeah, I think it's such a great example because the study was designed so well and done so well that we have a clear answer. And sometimes when studies are not designed well, we don't end up with a clear answer. But now, because the study was done well, we do have a clear answer. And you call it a negative trial, but that's the whole point of doing the trial, right? If we knew that it was going to be helpful, the trial would never have been approved in the first place, right? So that brings up a concept that I think is so important for families to understand. And the fancy word for it is clinical equipoise, okay? What it means is that we don't know what the answer is going to be. We don't know. We set up a trial and we don't know if the drug or the treatment is going to help or is not going to help. If we knew the answer, it would not be ethical to do the trial. And that kind of gets into how these trials are designed and planned. There's so much work that goes into it. Before any family sees a consent, there is an enormous amount of work that goes into planning and ethical review by an IRB, Institutional Review Board, that is comprised of multiple physicians and scientists who have to review every aspect of the study and make sure that it's ethical and safe for patients. And you won't see a consent if it has not passed IRB approval. So part of what the IRB has to think about is there clinical equipoise? Do we really not know what is the answer? And I think this HEAL trial, you bring it up being a negative trial, but that's the whole point, is that we didn't know. But now that the study is done and it was done well, we have a clear answer. And so it's a great example of good science working well.
Mm-hmm. And, I think what's interesting now too, and we've been working as an organization over the past couple of years to build this, obviously grow in multiple ways on the support side, the advocacy side, supporting research, and taking a lot of the knowledge base that we have. One of the biggest strengths of our organization of connecting for so long now, since 2010, is the expertise of families that have enrolled in these studies, that have gone through this. And then, really trying to be a good facilitator, because these are complex topics. We're not all researchers, and trying to understand what the context and nuance of these things are, and how it might impact care for our kids or those to come. And so, the HEAL study is really interesting right now because there are a ton of secondary analyses going on, meaning the people that set up this trial not only were great in looking at answering the question of does this intervention work or not work, but collect data that we can ask other questions and analyze. So the cohort is almost 500 babies, which in HIE is a lot. It's probably one of the bigger studies that has been done. And now there are secondary studies being done on that data, from MRI to EEG to potential for genetic to all sorts of things that they're getting published on medication utilization. Are there correlations with different socioeconomic factors with therapy utilization afterwards? I mean, goodness, there's so many things that are being drilled down in this data right now. Which I think is a really great testament to bring back to our community of participating in research. These are things that we don't know about our population. And we're learning more because people are choosing to spend time in the HIE space with research, and they're getting excited about how they can improve this for our community. You obviously are dedicating your life to this in so many ways. But there's so many other researchers out there. And one of the things that I think people are finding as they work with us too, as an organization, as we've been growing, is that we do have a lot of really engaged families that are wanting to be active, that are wanting to give their input. And we have a couple of different great examples of that in the present that are enrolling. We have 2 trials that, we're working with and have given input to the trial design, consenting, all these things. People who have served in those focus groups and have filled out surveys and things like that. It's not just like, oh yeah, let's get involved in research. Like, we are intentionally really trying to take these lived experiences and gaps that we know exist in the community and applying that to build better research, to accelerate research, to get people to be excited to work with our community. And ultimately, there are many things that we're doing on the back end. And I'm super excited to segue into the next part, kind of something that you and I have been working on a lot. So we see each other a lot, both on and off screen this past year, which has been really fun to work together, but also because it's really exciting work for this community because we have not had, and we all know this who have been engaging in this community for some time, there are significant gaps in what we know about HIE and especially long-term outcomes. I know this is like huge passion project that I can't wait to hear you talk more about too. But we have seen this as an issue, and in patient advocacy in particular, there is a concept of data registries that are out there of how can we, as a community that's already gathered 10,000 families strong, influence, bring our lived experience to hopefully help researchers understand more about our community to drive more interventions that hopefully will be effective. Can you talk about this HIE registry project?
Well, it's a cycle. You said, how can the community help researchers? But really, then it's circling back to researchers helping the community, right? So we can help each other. And there are, as you said, gaps in our knowledge, gaps in our understanding. So much of the medical literature in HIE is focused on what I consider to be short-term outcomes, like 2 years old, 3 years old, maybe up to 5 years old. But we know there's so much brain development that happens beyond that. And also, so many of the outcomes that are reported in these trials in the medical literature are scores on like a Bayley's test that a lot of folks probably remember having, a NICU follow-up clinic or something go through and do that assessment, which has some value, certainly, but is that really, it's a question to the community. Is that the most meaningful outcome measure to you? Or what is most informative to you to know about your child? Is it that Bailey score, or is it something like, is my Is my child going to need an aide at school? How much of their day is going to be spent in a learning support classroom versus a general education classroom? What kind of functional impairments are they going to have? Right? So those are the kinds of, we want to know what the community thinks is important. What are the outcome measures that you care about? And when this registry that what it means is that we keep track of individuals. Individuals volunteer to put their information in. And the structure that we're trying to build is multi-center. So it will reach across institutions. So regardless of where you get your medical care, it would reach across all of the medical institutions eventually. To combine clinical data, meaning the data with your permission, with your consent, of course, the data from medical records to know the clinical course, and link that with reported outcomes that individuals with HIE or their caregivers or families report, so that we can start to understand what are the factors early in the neonatal course and ongoing throughout as the child grows up. What are the factors that are most important to families, and what are the medical factors that correlate with those?
Yeah, that's, I can think of a couple of examples of, in 2019, we partnered with Trend Community to develop this, with our de-identified anecdotal data of identifying what the top unmet needs in the community were, right? And they put together this nice PDF. It's on our website. Anyone can go see it. And I'll link the website later. But that was when we were at 4,500 families. So now we've over doubled that in 5 years. And looking at, the top impacts were, people talked about seizures and epilepsy. They talk about sleep. They talk about stress and anxiety, parenting, right? And where we are 5 years later with that is we just shared a survey about sleep issues because we have Dr. Renee Shellhouse and others with her group that have listened to us saying, like, ad litem, like, sleep issues plague so many of our kids across all, mild, moderate, severe. And she, she approached me and said, "What do you think about this?" I said, "Yes, let's work on sleep, please." And so we did a survey with her because this process of getting funding is not a small one. So, wow, I have gotten a front seat to looking at funding for the registry that we're going for right now, funding for the sleep study that Dr. Shellhouse is looking at. It is a very complex, lots and lots of work goes on behind the scenes to get just the application in the door, not necessarily even getting funding for it. It's wild. I think everyone should get funded based on the amount of work that goes into these things. Oh my goodness.
Well, you have to think carefully about what are the questions you can ask, what are the pieces of data you can collect, what do those pieces of data teach you, and what conclusions might you be able to draw from those data, and what biases might be introduced by the way you collect those data. So all of those pieces are important, and it is a lot of work, but this is, we will never get answers for our community without doing this kind of work. And that's why research has to span the spectrum from that basic translational work of understanding what are the mechanisms underlying the injury, what happens to a brain after it's deprived of oxygen or blood, and what molecules are changing, what cells are changing, how can we find targets that might stop the injury or improve recovery, and at what time points can we intervene with those targets. From that kind of research, all the way through a child has become a teenager, and what's the natural history? What has changed over time? How can we correlate things that we're learning about our current teenagers or adults who had HIE more than a decade ago? What's new in their life at this point? And how can we figure out what are the important metrics, the important things for us to follow? How do we figure out what therapies, what treatments, how is our community engaged with different therapies, and which of those seem to be effective? Those are important questions that I think families want to know the answer to.
Yeah. And I think what we found too, as you know, like when we've been connecting, is that these themes do pop up. So when we talk about seizures and epilepsy in particular, right? And we talk about this a lot. We've built resourcing behind it to support families who go through this experience. But, HIE is the top cause of neonatal seizures. So there's a lot of work that's obviously gone on in the neonatal period. But then, like to your point, the gaps between many different facets of the medical system, where neonatology, we talk about this all the time, where long-term is like 2 or 3, and that's a lot of times where funding stops for these earlier things. And then onset of different things can happen far after 3, as we know with HIE. And that's like the really difficult thing for families is this wait and see, When we talk about seizures and epilepsy, and we identified and waved our hands around saying that there's a problem, that there's kids that there is no data that tracks a big cohort of kids yet of who goes on to develop epilepsy and why and when and all of these things. As a parent whose child has developed epilepsy at age 8.5, like I saw friends in the community go through that, and then I went through that with myself, and I knew, like how to elevate and advocate for care, what we needed, but like living through that experience, that was a game changer for us. We live our life differently now, and have for almost the past 4 years because of it. It's and many families can relate. So I think that's a data point, or sleep issues, or these things that we know just like are really rampant that we don't have a lot of good data on. This registry is a mechanism to collect that burden that is in a more synthesized way than a Facebook group, right? A more elegant and structured way and methodological.
Where we can start to understand what do all these kids who develop epilepsy at 8.5 years old, what do they have in common? Are there things that can help us predict for whom that might be most concerning or most likely? And are there things that we can do in the future to prevent that? It's going to take a long time, but it cannot happen without engagement of the community. The community has to be engaged in research in order for us to ever have answers to these kinds of questions.
Absolutely. So moving out of this present and where we're going with this, obviously we are hoping to get some funding to move this forward, but we'll find, if it's not this mechanism, we're going to find some other way to make it happen. But what we hope that looks like will be, like you said, there's a 2-pronged registry element. And so we've been, never want to recreate a wheel. And so there is a wheel already in motion called the Cerebral Palsy Research Network, or Cerebral Palsy, whatever you want to say, CPRN. And you and I both had the opportunity last week to be with the CPRN crew of investigators as we explore this partnership with them. And there's a lot of overlap with CP, but obviously there's a lot of kids with HIE that don't develop CP. And so we're looking at, they have this model where right now, if your kid has CP, you can sign up right now for MyCP on the CPRN website. And you can get different surveys to give information about your child or about yourself if you're living with CP. And the goal would be to have a complimentary track where, our families would input data and sign up very early. So you have that patient family inputted data like you talked about, and then you have that data that gets collected on the other side of it, and the medical records side of things. And things that we're looking at is, how do we know this, that, again, there's so many different systems out there within, you and I are based in the US, but obviously like within the US, there's a ton of different systems. And then there's obviously different systems outside of that. So how we're building this, can you talk a little bit about how we're hoping, this, of course, leads to different things of like that big picture?
There will be a lot of room for growth. This initial pilot grant, that the initial structure that we are starting with will work to just start and build the bones of the My HIE community registry, community survey, as you described, Betsy, that folks will be able to sign up, give some basic information about themselves or their child, and then you'll be included in this list of families who can be approached in the future for answering future surveys. So if Dr. Shellhouse has future additional questions about sleep in the community, she can submit a survey to the families engaged in this group. Many other questions as they arise. We've been thinking about kidney issues or dental issues in kids after HIE, or epilepsy, or many other things that can come up in the future. I think a lot of what families are curious about is what therapies people are engaging in, what is the community using, and cognitive outcomes, behavioral outcomes, school supports, those things that practically matter a lot to families that are often not reported in a way that is really digestible and easily implemented to life in our medical literature. So getting at questions like that, I think, will be really important. The other side of it right now is just starting at 2 clinical sites, collecting data just from the NICU neonatal course. But that is, again, we have to start with building the bones. And once the bones are built, then we can keep growing from there. And we'll certainly hope to expand to many other clinical sites, and not just the neonatal course, but more of the medical course throughout life.
Yeah. Something that we try to do, obviously, this as well, is build in a multidisciplinary way, because we know that like multiple perspectives, especially there's so many, in the medical and educational side and just life community, there are so many people that come into contact and work with our families. And having those multiple perspectives is really important to engage. And so we really try to do that early and often when we've seen, gaps where it's a lot of neonatology talking about what they consider long-term. And then we're looking at like, whoa, we know that this is a gap because of lived experience, but like, let's bring in neurology or vice versa, and bringing in neuropsychology and all these different specialties that we know are really important.
Rehab medicine, physical therapy, occupational therapy, speech therapy, all our favorite team members. It takes a village, and a really important part of that village are the individuals with HIE, their parents, caregivers, families. So important, because we can't gain this knowledge and can't move the field forward without the community.
Yeah. And so hopefully, this shifts once, of course, like as we move forward down this, it'll be a little while, but hopefully that shifts from these like Facebook and social media and email asks of like, here's a survey to, complete, that we have a little bit more of that systematized nature. And so, we hope that our community ask some really good questions. Maybe you're not able to watch this live, but you're able to watch it later. We will absolutely, this is a starting point of a conversation, of this dialogue, and I want to touch a little bit as well, because I see that we have a couple lost families that are tuning in, and we have families with older kids and things like that, the span. And a lot of times, in particular for our lost community, like, it's like, what is this engagement going to be? And where do we find things out? Well, there's different questions that like have come up for our community, with one, neonatal loss, but also loss in childhood, and looking at how this research can benefit, and how their child's life and story can benefit research as an extension of legacy. And that's something that I know I think about every day in this work, and I know you do as well, of how do we best, and sometimes answer those questions, like what kids are at more at risk for, for life-ending complications later on. What does that look like? Is there, there's some research that's done in the palliative care space and hospice space, but like, what is it for our community? We've seen a lot of, like in 2023 in particular, we had a ton of loss. And a lot of families expressed this didn't feel like kind of the other course that we've seen with a lot of our kids. And, I reached out immediately when I started seeing some trends and asking, like, is this SUDAP or is this like something else where this is just like a general, or decline, change of baseline. And, there's a lot of things that, again, we don't track right now to have a better understanding that can, again, hope to back up to intervene and improve outcomes.
Yeah, absolutely. It will be very important to engage our lost families in the registry as well, for sure.
Yeah. So I just, I know our lost families sometimes feel like, where is my place in this community afterwards? And we want to, like, I really feel strongly that, like I see Becky joined in, who's on our board, who, is in the lost community. And, one of the things we talk about often is research. Like, that is like something that families can give back to and help, with their story, with their records, things like that. There's all sorts of different ways that we hope to engage.
Yeah, absolutely.
So moving forward, we talked about why is the registry helpful, moving forward with, engagement long-term and things like that, which I think we're seeing a shift in our community as things are going. And, we've gotten some feedback before of like, is this just neonatal? And I want to share, at least from my perspectives, that I have a lot of meetings with a lot of different people, exploring what advancements are coming up, what they're working on in this pipeline of like this preclinical to clinical trial and research study and onward. And there are things for both. There are things for kids, moving forward. There's things with CP, there's things with epilepsy, there's interventions that they're trying on the educational side. There's just all sorts of things. And we do have an equity of focus. So if you hear a lot of neonatal, it's because there is a lot of neonatal acceleration right now, but there is also acceleration in the outcomes from HIE that I think, we will be I know we will be talking about more with our community. And I'm personally excited about a lot of these projects. But it's really tricky too. And what I find difficult in this role sometimes, and I'm sure you can relate, when you hear about things that you're like, how do I, like, it's not ready for prime time. Like the registry, we've been working on it for 14 months now, 12, I don't know, some crazy amount of time, weekly with a full team of people, like submitting for grants and coming up with structure and how all these elements are going to work. And it is really difficult. I have background in communication, so I want to tell everyone everything all the time, but like, I can't because things aren't ready for prime time yet. So, I'm excited that we actually get to share today that we've been working on this and that, we will be informing the community as we go about the status and how you can be more involved. But the data is, I want to go back to like and we'll talk a little bit about like, addressing concerns and things like that. Because I know when we talk about data collection, people have, all sorts of feelings one way or the other about it. I'm a person that's like, whatever, it's, like whatever's going to help, I'm happy to submit, but also data protection, protecting our kids and protecting our kids' data and things like that. So, we've talked a little bit about why, why it's important for families to consider engaging in research. But like, when I guess as we try to move forward, like I want to make sure that families, hear it from you as well, who's been in the in the weeds with this, about what they can, kind of expect of like what are some of the common practices for data protection and things like that for privacy.
Oh yeah, there are a lot, and I can't go through them all right now, but
Yeah.
But as a start, again, the IRB, the Institutional
Mhm.
Review Board, has to carefully review any research that happens. And if there is PHI, protected health information, then it has to go through a rigorous review process, again, with physicians and scientists to decide whether there's any risk to individual that is contributing, and if so, what is that risk, and then making sure that it's ethical. So there are a lot of mechanisms for patient protection and engagement in research.
That's really helpful.
You mentioned also inequity of focus, and I just want to take that opportunity to say that some reasons that it can be difficult to engage kids who are older in HIE is because it's hard to, it's so heterogeneous. The kids are spread out across multiple medical centers, and it becomes harder to kind of corral them and keep track of them. But as we build this registry, it will make the tool to access families in a systemized, organized way much easier for researchers. And it will make it much more reasonable and much more feasible for medical researchers, physicians, and scientists to be able to ask questions to help us gain more knowledge in that space. So,
yeah, really helpful.
Yeah.
For sure. So if people want to learn more about, understanding research and, especially like clinical trials, research studies, the differences, the nuances, the structure, all that, and data, there's some different resources. So you actually helped drive the content on this page to our clinical trial and research hub. So that's at hopeforhie.org/clinical trials. So anyone can go check that out. We have a basic overview of, of getting involved in research, of getting involved in clinical trials, what different trial design looks like, or research, and what, all the terms mean. We talked about that a lot today with all these complex terms that might be new and unfamiliar to people until you start digging in a little bit more. And on this hub, we also are listing, different links to studies that are existing for different diagnoses, different outcomes, different things that different groups that we're aware of that are asking us because it is our community or things that we're partnering with. But that is a site that we're trying to build that is a true hub that people can go to and get good information.
Yeah, it's fantastic. I can't say enough about all the resources that you've built and the Hope for HIE team have built for families to help engage and understand. It's fantastic.
Well, and we're always trying to work on making it more accessible. So if there's things that everyone that's watching this, if you have questions about, at any time, reach out. So, or if you're approached about a study and you don't know, we've tried to, build in some of those resources as well, understanding that, especially, we have these neonatal trials that are enrolling right now. There's a study with a novel therapeutic that is in conjunction with cooling. And then there's the Cool Prime trial that is enrolling, mild HIE with cooling. And so looking at, these families that are enrolling right now or being asked to enroll, there's a lot of questions. We all know it's a short time period. Most of these, like the consenting is within like the 6-hour period for cooling, even if it's something cooling plus. So, I think about obviously outside of the neonatal period, you have a little more time to think about and consent in. But if you have questions about what that is, or you want to hear from an experience of a family, we also have a peer support lead, Allison Moyes, who is working with us. She's a trained peer support mentor. Her son has also enrolled in different clinical trials. She is an excellent resource that we can connect people to, and has been working with us with these trials too. So when families have questions, we can get them answered by family members as well. Because sometimes it's overwhelming and you have questions that you might, feel uncomfortable asking of a medical team versus wanting to hear from another parent who either has or has not enrolled in a trial. So trying to make that as accessible as possible too.
I think that's critical because, there are always, in the moment, especially in that acute period, 6 hours is awfully fast. And you can imagine that moms especially are going through a lot in those first 6 hours, right? So the birthing parent is going through a lot in those first few hours. So the knowing that you are focused on the getting to the best outcome for your child, feeling comfortable that you can ask any questions, that's really important. Yeah.
Thank you so much for sharing all of this update today and really talking through how important it is for our community to have data, to be a part of this, to have this relationship with research, so that way it is mutually beneficial and bidirectional. And, I know when we've had these conversations before, like in your own work of, studying sex differences in the HIE mouse model and how you might, be able to tap into a registry to see like what are some outcomes and the differences, or what does the MRI look like, or what does the EEG look like, or something like that, and how beneficial that might be. So I'm really hopeful that we get to that place. I feel like we will. And it's the whole community coming together for that. And so any last thoughts that you want to share with, families or anything before we wrap up?
I mean, just the importance of, we can't do it without you. So if you are invested in improving outcomes for kids with HIE, we need you engaged and involved. So let's be a team. Let's do it together.
Absolutely. And this is just another part of our organic growth as an organization. So I talk about the stair-step growth that we've had, where we, focus a lot on new support programming and then focus on accelerating advocacy and research. And so this is on that advocacy and research bucket, but know that like we are, as you might have seen, people that are watching, we just announced another support program last week for kids living with HIE and growing up with HIE. And so we're always trying to do more of where we can, when we can, how we can. And this focuses on that advocacy and research side. So thank you so much on behalf of the whole community, which you're also a part of in multiple ways, for your research, for your advocacy, for your involvement, and your endless contributions to this. I hope you get a break soon. Like, I don't know when you sleep, but I am personally very grateful to have you on our medical advisory board, our board of directors, and just driving forward things that we know will make a significant difference for this community that needs it. So we're really, again, grateful for you and grateful for the HIE community at large as we come together and, tackle these different opportunities that we have to really, move forward that vision of improving the quality of life for children and families impacted by HIE.
Thank you. I'm grateful to this whole community. I mean, I love these kids. I love these families. So it's a joy to see the growth and help move things forward.
Awesome. Well, thank you everyone for attending. If you didn't have a chance again to attend live, catch you on the replay. We are here for questions always. There's multiple ways you can reach out with those on our website, social media, etc. Feel free anytime. You can comment back on this. We get notifications and we'll do our best to answer questions as they come up. Dr. Danielle Barber, thank you so much for today. And we will talk to everyone soon on our next live.